It's very important to seek help from a physician if you're having atrial fibrillation or been diagnosed with it. An electrophysiologist is a cardiologist who went on and did additional training specifically with heart rhythm disturbances. It's a board-certified subspecialty of cardiology. There are 3 electrophysiologists at St. Francis, as well as a team of cardiovascular surgeons, and all of us have a huge interest in atrial fibrillation. It's a very common rhythm. We know it's an increasing issue for a lot of patients. It is one of the large causes of stroke in the United States population. The second reason is that atrial fibrillation commonly goes much faster than your own heart rate. And we know that if people are left untreated with their heart racing, it can actually cause other heart problems. The heart can kind of become a worn-down pump when it's racing that fast, and that could lead to heart dysfunction and other problems. And then the third thing is a lot of people don't feel well in atrial fibrillation, and a decision somewhere along the line should be made whether you're going to try to get them out of atrial fibrillation and preserve their normal rhythm, which oftentimes makes people feel a lot better. One of the huge advantages I see in our program is the collaborative work that we do with the surgeons. And so when a patient has to take that next step and do something more invasive with their rhythm problem in order to get relief, we feel that discussing it amongst both modalities tends to give them a better and a more cohesive decision about what treatment plan might be better for them. We have a new electrophysiology laboratory that includes a 3-dimensional mapping system where we could map atrial fibrillation. We also have a biplane imager that allows us to image the heart in 2 planes, and we feel that this may help reduce the X-ray exposure to someone during these procedures. The things we have to offer at St. Francis are certainly more advanced than a lot of hospitals have to offer at this point. The technology we have to offer along, as well as the expertise of the physicians, is a nice combination in trying to give the patients the best treatment we can. And we're lucky here to have a surgical group that has a second way to try to treat atrial fibrillation, which instead of working on the inside of the heart, which electrophysiologists do, they work on the outside of the heart without opening up the entire chest and obtain the same success rates. And the great thing here at St. Francis is that we work together as a collaborative team. So we approach it from the inside of the heart. If we think approaching it from the outside of the heart is better, we have a great team of surgeons that can approach it from that aspect. Follow-up care for atrial fibrillation can be very time-consuming, and because of that, we've hired and we have present an advanced practice nurse to help us in the atrial fibrillation clinic. We know that atrial fibrillation can reoccur. We know that there isn't necessarily a perfect treatment for atrial fibrillation, and because of that, we feel it's important to have someone accessible to the patients. Atrial fibrillation may not always be preventable. The reality of it is that people develop heart disease for a variety of reasons, and we know that where heart disease goes, atrial fibrillation goes. We also know that as you get older, atrial fibrillation develops, and again, there isn't a lot you could do about that one. What does make sense is to try to stay as heart healthy as you can.